let me start it without wasting a minute. Thank you, Dr. Sonam, for highlighting the impact the physiology. As you already know about what is the physiology, which is going with the three stages, three phases of the labor. And now I will continue with the same, with the climax of our today's webinar, that is labor. But before starting with the labor, I would like to talk more about what is before the labor, recap part. So the whole story will begin with the your pregnancy part. From the your pregnancy is a journey of gestation for 9 months. For the first 3 months is your first trimester, next 3 months is your second trimester, and last 3 months is your third trimester. From first trimester, there is more changes in mother and less changes in your child. And in the second trimester, more changes will be in now baby and less changes will be in mother. And in the third trimester, we'll have equal changes in fetus as well as mother. So as a physiotherapist, what are the approaches? What are the means you are a student and now you get to run sometime to your internship or to any hospital or to any clinic, and you or even in your household, you saw any woman who's soon going to be or in future for a labor part. You can, I hope you can help her with this session. So we'll start with this, with the basic anatomy first. So I think this is visible. So this is, you can see pelvis. It is the basic central part of the body, pelvis, and it will connect your upper limb, upper body and lower body. So pelvis, now you can see how much pressure it is exerting from the upper limb and how much it is very important for lower limb to carry out your upper body with it. And it is also helpful in your stability, like posture, you can see, and your center of gravity is passing through your second sacral vertebra from here somewhere, and your LOG is passing through somewhere here. So why I'm telling this, because when we are going to approach with the methods, with techniques, we should know about these things, like where is the pelvis and what is about the muscle, your pelvic floor muscle, and your pelvic floor muscle is what kind of muscle. It is important because we have to reconnect a lady with a muscle only. So now this is in the center part of the body, and we'll understand better than this. So this is a big model. As you can see in this model, we are having two ischial crest, basically ASIS, and in the back PSIS, and we are having your symphysis pubis will be there, and in the back we are having your sacrum and your coccyx. Now again we are having two ischial, two sits bone. These are sits bone because these are the bone on which we have to sit. But most of time we are sitting like this or like this. Either we are leaning or like lurching, or we are tucking our coccyx and are hindering our muscle. So this is what we have to look after whenever we are dealing with a obstetric part, and we are dealing with a woman who is going to deliver, who's going in a labor phase soon. We have to tell her, and before telling her, we should know actually what is going with the bone model, what is going with the skeletal part, what is going with your muscular part, and what is going with the hormones. As hormone part is already covered by ma'am, Dr. Sonam, and now we covered basically. Now this is the phases, the three phases will be there, and what is going with the three phases, your inside and outside of the your bone model, your muscle. So just keep this figure, keep this picture in your mind before talking to a woman, because you should be clear. And I think so ki most of you are not or not everyone is a woman, so, and not everyone is a pregnant or already gone through this phase, so you can't imagine on your body. So just remember it, the baby is going to be inside this space in the pelvic organ, that is uterus, and we have to just keep in mind about the pelvis, about the pelvic floor muscle, and about your core muscle. So from first, I hope this is complete now. Ki two sits bone, ASIS to PSIS. In behind we are having your sacrum and coccyx. Your symphysis pubis will be there, and this is your true pelvis, mid pelvis, and this is your false pelvis will be there. So now we'll talk about the muscle. Whenever we are talking about the muscle, these are the hammock shaped muscle, pelvic floor muscle. And why we are talking about these muscle? Because in point of view of obstetric physio, it is important to know in detail about these muscles. These muscles, like we are having in the external part, we are having your labia majora. In inner lip, labia minora will be there. Your two, you can see this whole muscle is a hammock shape, which is highly compact. And we are having structures like your urethral opening will be there, from which you are passing your urine. Then we are having your vaginal opening, from which the baby is going to come out to this world, and it is also used in a sexual part too as a woman. Now we have perineal body, and in the end we are having your anus. So anal opening. So now we are having this levator ani, that is pubococcygeus and iliococcygeus muscle, and from inside you can, if it is visible, we are having your coccygeus muscle. Here we are having a coccygeus muscle. These muscles are important because what is actually a labor? In a labor, your baby head is going to descend, baby body is going to descend down to this perineum and going to create a pressure on the perineum part, the basically at the posterior pelvic floor muscle, this muscle, and you are having your ischio-cavernous in front and bulbospongius here, and your superficial transverse perineal muscle. So basically, pelvic floor muscle is divided into three layers. First is your urogenital diaphragm, in which we have your urethral opening, your vaginal opening, and your STP muscle, your ischio-cavernous and bulbospongius is this way. This part we are having in the your first layer. In the second layer, we are having deep muscle like deep transverse perineal muscle. Your pelvic diaphragm will be there with the urethral sphincters. Then in the third part, we are having your endopelvic fascia. So now you can imagine a whole of baby is going to come out via this tiny hole to this world. So we have to prepare a lady because pregnancy is a marathon, and if we are not preparing our women for this marathon, then definitely they are going to run the marathon because it's a natural process. But they are going to create too much trauma on their this muscle. There can be chances of prolonged labor hour. So as a physio, you can reduce this labor hour, you can reduce this pain chances, you can reduce this trauma, and you can be an active member, an active participant in their throughout process. So this is your muscle, and now we talk about the pelvic organ. Just these muscles work as an sphincter because due to these muscles, we are not leaking, our urine is not leaking out. And these muscles are work as a sexual part too because they are having your vagina. They work as an they work as an your stabilization because these are the muscle. You can see from here, these are the muscle because of which we are having our stability. These are the muscle which is supporting our pelvic organ, that is your uterus, bladder, and your rectum. So this is your like uterus will be there. In the anterior part, you are having your bladder here, and in the posterior part, you are having here your rectum. Now this is the proper positioning will be there, and now you can see, you can imagine when a woman is get pregnant and she's on her 9 month, that means this uterus is going to be like this, and with this fully developed uterus, we are going to create more pressure on the bladder part and again on the rectum part. That's why if अगर आपने कभी एक pregnant lady के साथ deal किया है, you come to know कि how much she used to go to washroom to pee out, and she's also complain of constipation always. Why? Because in the anterior part, she's pushing the organ is pushing her bladder, and that means creating too much pressure on the bladder, due to which she is having an urge to continent every time she want to go to the washroom after every 1 to 2 hours. And in the back side, the uterus is creating more pressure, due to which the woman, I think you all know ki, with the enhancement of pregnancy, there is like change in the posture of the woman, means more lordotic posture will be there, means the woman will be like she's like this, she's with more lordosis will be there in her spine, in her lumbar part, and more kyphotic on her cervical part. So that means you can imagine how much pressure she's creating if she's going through this process, this nutation. That means her posterior pelvic floor muscle, this muscle is going to be overused, and the tailbone is going to be tough. That means the muscle is going to be too tight, this posterior muscle. And because of this tightness, the women is always complain of constipation. And in the anterior part, where we are having urethral opening, you can see here the woman is having too much push on her bladder due to the growing uterus. So this uterus will create a urge to continent every time she's like she goes to washroom, and every time she feel about oh, now I have again go to the washroom to pee out. So this is why, this is because of the anatomy of this pelvic organs. And so this muscle, this most ignored muscle, is the muscle which just support your these organ. This is a major muscle because of which we are we are carrying our baby without any tension, without any stress. So we have to, as a physio, we have to train our woman about this muscle. Then second, there comes the inner core muscle. What is inner core muscle? I think if you know, the inner corset muscle is form of four muscle. That is, first is your diaphragm upper part. Second is your in front muscle anterior part, that is transverse abdominis, somewhere here. In the front, in the upper part, you are having your diaphragm muscle. In the front, your corset muscle, that is transverse abdominis. In the back, you are having a parallel muscle, that is multifidus, and in the somewhere here you are having your pelvic floor muscle in the inferior part. So these four muscle this whole box-like structure is known as is your inner core 4 muscle, and this muscle, these 4 muscle are very important when we talk about the ops part of a woman. So we have to retrain and train, and then again recovery of these muscle are important when she is in non-pregnant state. She's pregnant, and then again she's again in non-pregnant state. We have to prepare these 4 muscle, because these 4 muscle are important for her stabilization, her support, and her basic breathing pattern too. So this is like, this is whole structure. These are the muscle. And now again, we'll talk about the labor part. As Dr. Sonam already told, basically what is it? It is the 3-phase process. First is your effacement and dilation. Second is your delivery of baby. And third phase is your delivery of placenta will be there. So in the first stage, that is effacement and dilation, you are going to deal with the first phase is now again divided into 3 phases, 3 stages we call. First is your prodromal stage, second is your latent stage, and third is your transition stage. So now again, from here, now you can imagine this is a baby, and this baby is going to descend down to create pressure on these perineum muscle, and because of the pressure created by this baby head on the perineum muscle, perineum will create a more overstretching and lengthening of these levator ani muscle, means they are moving more sideways and outwards. ये बिल्कुल बाहर की तरफ जाएंगे और वो भी बिल्कुल साइड होते चले जाएंगे to give space to a baby. Then again, because of this process, these muscle will become thin. Thinning of these muscle will be there due to this overstretching. So these muscle thinning will lead to more anterior formation of your birth canal. That is more anterior, your vaginal opening will open to more anteriorly. Means anteversion of your that uterus will going to be more anteversion. In this way, your baby is going to come out in this format. So now again you will know the baby is going to come out. This is like your whole uterus will be there, and this is going to be in this way, in this format. Your baby is going to come out where this hole, and basically you can, I think, more clear with this. Yeah. So your baby is somewhere, anywhere here on the endometrium part of the uterus, and your baby with the descending process, it is going to move down and create pressure on here, the cervix part, and the cervix dilation of the cervix will started, and the vaginal opening will going to be more anterior. Means the baby is going to be head going to be in this way. The baby is going to come out in this way in the world. So the posterior pelvic floor muscle thinning will be there. Anterior pelvic floor muscle is now going to be to relax, and your cervix is going under dilation. Your dilation of cervix means this space is going to be open, which is closed because of the your pregnancy due to hormonal changes. This cervix is closed because of the hormonal changes, and because of hormones again, and because of the pressure, this opening will take, this dilation will start it, and from this space there will be a space of from 0 to 10 centimeter, maximum 10 centimeter when the space got. From here your baby will descend down via this space to the world. So in the stage 1, what is going, basically in the phase 1, effacement and dilation, your baby head is going somewhere here, putting pressure on the perineum, and from here your opening will start it from, like this is the opening, and it is going to start. In the stage 1, it is going up to 0 to 3 centimeter or 2 centimeter, and it will take up to your day, 2 day or 3 day, or it can be up to 20 hours too. Then the stage 2 will be from 3 centimeter to 7 centimeter. From here your contraction will going to be more intense, more regular, and the interval between the contraction and relaxation will be 15 to 20 minutes, and this phase will take up to 20 minutes to 20 hours. Then again we talk about the third stage, that is most important, because from here 7 centimeter to 10 centimeter your whole dilation will be there. This cervix will going to be open like this. So this is like, this space is going to be created, and from where your baby is going to be more descend down, and we have to prepare the woman. But before preparation, we should know, we should keep some things in our mind, like in stage 1 will be there. If we come to know, okay, this is the stage 1 time, that means the dilation will going to be 2 to 3 centimeter. That means there's no no wastage of pushing should be there in the stage 1, and in the stage 1, and then again in stage 2 when it is up to 7 centimeter, the woman should start with proper walk, and she should have compatibility between her rest and her mental well-being and her movement, because we need all 3 phases. We need rest too, because within some days or within some hours she has to be in labor, actual labor, and for which she has to create too much pressure, too much overstraining, and too much trauma will be there to her muscles. So she need a good rest, good food, and good hydration. So we ask the lady in the stage 1 to go for proper rest, proper walk, and some kind of activity like she can go for your duck walk, and she can also go for squat activities. But if she's well prepared, then only we'll advise her after seeing her all reports like her sonography, her vitals, if she's like she can do it or not. Then in stage 2, she continue with this with the beanbag sitting. Then in the third stage, we ask her to start with the let go breathing. Means just start with normal breathing and breathe out. Means ask her to connect with the that baby. Ask her to connect with the muscle, and ask her to think about the baby. So this is like all about your phase 1. That is effacement and dilation, which is all about your baby head is going to engage, and this hole is going to be 10 centimeter, and our baby head in the transition phase. You are going to see the hairy like structure from the vaginal opening. But if you are not licensed for it, please don't practice it, because it is going to be trauma to your degree too. So now again we talk about the stage 2, that is delivery of baby, the most important stage whenever for what we are preparing our woman for. The stage 2 is basic about your 10 centimeter opening will be there in the third stage, and in the phase 2 delivery of baby, your baby head is somewhere here, like your baby head will be somewhere, it is like shown like this, and from here your 10 centimeter opening will be there, and baby head will going to descend down, creating pressure on it. And here there are two stages. First is your rest stage, second is your active stage, or we call it rest, we call it relaxation stage, and second is your contraction stage. So whenever a woman feels the contraction, then too she have to create that proper breathing pattern, proper pushing condition. But when she got the rest stage, that means she has to rest too and let her baby turn on her own, because rest is all about you have to rest, you don't have to over exert. In the second, for the second stage, as a physiotherapist, you have to prepare the woman about the two stages. First is your resting stage, and second is your contraction stage. For the resting stage, the woman have to be rest, and for the contraction stage, the woman has to go for the pushing phase. Now we have to prepare her for the pushing phase. So this is all about the three phases. I think it is visible. So this is your contraction phase in the stage 1, when the delivery like effacement and dilation will started of the cervix. The contraction time will be of 30 seconds, and the duration will in between is 15 to 20 minutes. It can be up to 30 minutes too. Then again contraction will up to 30 second last, and with duration it is going to be more regular and intense. Then in the second stage, again when the opening will dilation will be up to 7 centimeter, the contraction will be of 30 to 60 seconds, and in between 15 to 20 minutes again for the relaxation. Then again she got the contraction, means she got this contraction, then relaxation for 15 to 20 minutes, then contraction for 30 seconds for first stage. For second stage, she got for 30 to 60 seconds when the this opening is 7 centimeter, 15 to 20 minutes gap. It can be up to 30 minutes too, according to how much your baby head is there, is effaced, like low engaged. After 7 centimeter, then again comes the third stage, that is 7 to 10 centimeter of the phase 1, that is effacement and dilation. We have contraction for 30 to 90 seconds, means for 1.5 डेढ़ मिनट के लिए contraction रहेगा, and will have 15 to 15 मतलब 10 to 15 minutes in between relaxation in the ending phase. And with the starting of your second stage, your second phase, that is delivery of baby, your three conditions will be there. First, contraction will be more regular, more intense, and in between time will going to be 3 to 4 minutes. Means contraction will be of 30 to 90 seconds, relaxation will be of 3 to 4 minutes, and then contraction, then relaxation, then contraction. Means urge to push become now more intense and regular, and the woman is getting more contraction, and she's like more in pain. She's having more sound, like she's shouting that baby is going to come in any way. So now from here, at that time in the second stage of first phase, when it is 7 centimeter, there's chances of getting vaginal discharge that can be orange or red or watery in watery format, or it can be thick. That is your amniotic fluid, which is protecting your baby from all kind of shock activities inside the womb, inside the uterus. So it is like it is already worst and will come out through your this segment. You will feel some kind of discharge, watery discharge. So at that time, Ask that lady to remember the term TACO. What she has to note down, like first is time, at what time she got the discharge, or she remember it, or if she has someone with her at the home, she can note it down, like time of discharge, amount, and your color, what color she got, and order, what order she have on that discharge. So these are the TACO term we should tell our woman to tell her obstetrician at the time of delivery, because it is going to help her in the delivery process. So from here, the discharge will be there. Now again, the women always ask for that main question. They will ask you to, like, when is the actual labor time? What is the true labor and false labor? So the true labor is basically about your main thing, that is you will feel like it is more intense and regular, whereas in the other hand, false labor is more about from here. False labor, your abdominal is a compartment, four compartment, you can understand. In between you're having your umbilicus. So these four compartment, in the false labor pain, just above the navel, you will feel contraction in any right or left side of compartment. You will feel contraction, but the contraction is not increasing by with time, and the pain is also consistent. It is like a regular pain, and it is not increasing, it is not gradually increasing in the false labor pain. Second, the pain is not radiating to your back or to your genitals. This is the like actual thing. For 2 to 3 hours, you are having contraction, and it will go away. Even if you will go for simply massage, it will go away. If it is a Boxton Hicks contraction, means the contraction because of your round ligament. Somewhere here, your round ligament, which is stabilizing this uterus in your pelvic floor muscle and in your pelvis. So these ligament is going to stretch it. So because of these stretching, you will feel that contraction sometime. So don't worry, it is not your true labor pain or false labor pain, because there in false labor pain, remember three things. First, pain is not increasing, contraction is not increasing, and there's no discharge. Whereas in the true labor pain, a woman will feel the pain around her whole abdomen radiating with time to her back muscle. She will also feel like some kind of heaviness in her perineum, on her over her perineum. She will feel some kind of heaviness, and just below the your diaphragm, from here she will feel some kind of smoothness somewhere here, just below gyphoid process. She will feel more kind of smooth relaxation. She will feel more happy, and she'll feel more relaxed, like something is going down. She'll feel that movement of a baby. And just in the side part too, she will feel emptiness somewhere here, because the baby is already going down to here, to this muscle. The baby is moving down because it's the time. And there's also watery discharge from the vagina, that is your amniotic fluid. So water eruption will be there, and your pain is gradually increasing, your contraction is increasing and become more intense and regular with time. So this is your true labor, and this is your false labor. Now you can remember what is true labor and what is false labor. Then now again back to delivery of baby. Delivery of baby, like the baby is already transition phase will be there. In the resting hour, the head is going, the service is going to be this, and the your uterus, it is going to be relaxed. But when it comes to the your active part of the your contraction will be there, and now the uterus is going to be more. The uterus wall will create more contraction to push that baby out of that vagina. So via cervix, that baby is going to be come out through this wall. So that means your whole body. This is a natural phenomenon, and nature made us like this only. The baby is going to be come out in either way, if you know it or not know it. If you're trained, then it is going to come out, and if you're not, then too it is going to come out. But what is the difference between trained and non-trained? If you're trained, then the chances of getting more pain will be less. Chances of getting prolonged hour will be less. Chances of getting your oxygen supply will be more to organs and muscle. Less chances of getting trauma to your muscle. Less chances of getting any kind of future dysfunction like incontinence, or chances of getting fistula will be less. So that means you are less traumatizing when you are trained one. And if you are non-trained person, that means the women is going to be full of stress and anxiety. Thanks to our Bollywood movies, they used to show our woman like labor is all about trauma, and she's going to be panicking, and she's worried about when the baby is going to come out and how the baby is going to come out. Because in the traditional time, we are going to be we are living in a joint family. That means we have lots of memory and lots of experiences of our elder women and our fellow women. But now, as a recent advances, we are in a nuclear family. We don't know about, we are having lots of misconception about the pregnancy, about the conceive part, about the labor phase. So this confusion is going to hinder the labor hour, is going to hinder that pain, it's going to increase that pain because of the more chances of getting cortisol hormone, that is your stress hormone. So if a woman is well trained, that means she's going to have more endorphin hormone, more positive hormone, and she's more confident and she will feel more free. So, traditionally, in the earlier time, we are using the methods like first is your Lavoie method. In this, the doctor asked about, the doctor took a group of women in a row and they, of a pregnant woman, and they asked them to you just think about the child. Just think about the child, just close your eyes, think about the child in the Lavoie method, and just go with the flow. Whatever come in the way, just think about the child and push the baby out. So this is the Lavoie method which we talk about in the earliest part of the our training. But in between of 90s, we got the your Bradley method. Your Bradley method, Sir Bradley talk about the things like mother and her inner instinct. Like whatever the you are a mother, when you are in actual labor phase, they ask their pregnant woman to just use their common sense at that time. Like which is Bradley method is also famous by name no violation while birthing, means non-violence birthing. They promote non-violence birthing, means just use slow relaxed breathing and just use your inner thoughts as a mother ki how you can just save your protect your baby. So this is how we use in our earlier method like Lever method, Bradley method, and their third comes the, I think most of you are aware with the Lemmas method. Lemmas session will be there. In the Lemmas method, what is the difference with all those two practice method? The Sir Lemmas they talk about basically just educate our women, just prepare our women, just do workshop with the woman who is pregnant, just prepare them about the labor phase earlier. They are promoting the rehearsal of the labor just before the actual labor. So this is all about the lemma session. We talk about your proper breathing, your proper positioning, your proper education of both mother and father, and a family member too sometime if a father is not available. So now and again, now lemma's method lacks something also. That's why again there comes the fourth method, that is hypnobirthing. So in hypnobirthing, we talk about the child too, we talk about the mother instinct too, and we talk about the education part too. So after reading and continuing with my career as an ops gynae from US to India, what I in common I found in my practice, and that's what forced me to make one method. In our hormonal wings, we have one method, and we use combinedly all the method inside it. Like first thing, we start with basic things like we ask our women for imagination too. We teach them about it. Like we start with proper counseling, education of a mother and a family and a father, and proper telling about what is the phases and what is going to be with you in their common or regional language. And fourth thing, we are just dealing with the dysfunction. We are telling them about if you're not going to do this, okay, then this is going to be happen in your near future. You're going to found this issue, so that this will work as a biofeedback to them. Then again, we'll start with the your muscle awareness, muscle identification, then again muscle activation. So because most of as a doctor, if we all don't know about the pelvic floor muscle, we lack this information as a medico about the pelvic floor muscle, then how come we just think about a common woman who will know about this muscle? Because in India it is a taboo to talk about the vagina, to talk about any sexual health part in a open places. So they are not even knowing a bit about it. So we have to prepare them, we have to educate them about this, basically this about this structure, this muscle, and this is not more a taboo. This is a more pure muscle, because from here you are going to get the love of your life. So now the first phase is their, second phase is their delivery, and then third phase will be delivery of placenta. After the delivery of baby, just after 20 to 20 minutes or within an hour, the again one contraction will be there inside the uterus, and this will push out your placenta will come out after in the third phase. So these are the three phases, and in the hormonal wings, we talk about basically like how we have to prepare the woman. Now, as a student, you all know the three stages about the physiology. Due to Doctor, thank you, Dr. Sonam, for this. About the physiology, about the basic muscle, about the basic changes, about the physical changes, about the hormonal changes. Means this kind of contraction, then relaxation, then again contraction. Means from the first stage to second stage, the time of resting stage will going to be less. From 15 to 20 minutes, it is going to be 2 to 3 minutes, and the time of contraction, that is start with 30 second or 20 second, is going to be more intense and regular for up to 1.5 minute. That means 30 सेकंड से 1.5 मिनट तक का कॉन्ट्रैक्शन बढ़ेगा. And for this contraction time, we have to prepare our woman to push out that baby. But there are like, the basic principle we use behind it is your alignment, your breathing, and your coordination. Means alignment, like we have will prepare our women for the proper posture part. We'll prepare them how to properly use that posture. Don't just push out to be more lordotic, more kyphotic. How they can just settle it in a proper posture. Means उनको बहुत सीधा नहीं होना है. They are going to be just always sit on your sits bone, always sit on your sits bone like this. Don't go like this, sit like this in a lurch position. Don't go like this. Just be in a discomfortable position. Yes, for some second you can move, but don't try to act in a, because if you're going for lurching, that means you can see there's more from here. You can see there's more tucking of tailbone will be there to your muscles, and it will lead to more chances of getting constipation, more chances of getting anal fissures in the future, or which is not going to help your mother during delivery, during labor phases. So for the first phase, we have to prepare our woman that you can start with. जैसे for example, अभी मेरा आज first phase है. What I have to do as a woman, मैं वॉक करूंगी जितना हो सकता है, मैं स्क्वेट करूंगी. ऐसा एक प्रॉपर एक फेज रहेगा. स्टार्ट विथ वॉक, स्क्वेट, देन वॉक, देन गो फॉर लंजेस, then go for walk, then rest for some time, go for proper breathing, then again do it. Whenever you are feeling comfortable, go with the movement. If you are living in an apartment or in a flat, just go with the walk in your surrounding, in your room too, in your room only. You don't need a park or kind of road or a free area. Room is sufficient. If you want to walk, room is okay with the places, with the distance. Because what we need at the end is the movement of your muscle, means more relaxed muscle. Because if this during the push out activity, if this muscle is going to contract, that means our baby head is somewhere going to stuck here. So that means we have to just relax this muscle so that our baby can easily come out. So first stage will be there. We'll ask about just go for movement, go for rest, go for beanbag sitting, go for squat, go for wide abducted leg sitting. And second stage we'll talk about, but with the methods. For hand-on practice is not possible in this session of webinar, but some session like we'll talk about first with the visual imagery guided technique. In the third trimester, from 36 weeks, after just seeing her proper sonography reports, her vitals, you will plan out about the lemmas, your hypnobirthing session, that is hormonal wing session. We'll talk about the session which involve your lemmas, Lavoie and Bradley method. We'll talk about everything. For the first, from the end session of second trimester and the mid session of third trimester, just let the woman do with the visual imagery guided technique. In the visual imagery guided technique, what women have to do, just like you can imagine, like I'm sitting in a relaxed position on my sit bone. I am just sitting like this. My hand will going to be one on chest, on just my over my just below my clavicle, and just over my abdomen. I'm just going to be this much of relaxed. Use pillow if it is possible, and just going to sit with the abducted leg. And I'm going to ask the woman, just close your eyes and think about the places, or just think about now you have your labor, you have your delivery, and you have your baby in your hand. Just think about the baby, or just think about your prepartum stages, like when your baby kicks you, when you talk to your baby. Just start engaging the mother with the baby memories. So this is how the woman will start connecting with her baby with the visual imagery guided technique. And this technique will involve your pursed lip breathing. Like she's like in this, and she will start breathing through her nose, and her abdomen is going to protrude out, her chest is going to be up, and her intrathoracic space will be there. So means this muscle is going to be relaxed. Whenever we are inhaling, this muscle is going to be toward ground, means this is expanding. And whenever we are exhaling through mouth in a pursed lip, this muscle in a natural process, you can feel it on your muscle, either you are a girl or a boy, you can feel it. Just inhale, and this muscle is expanding, and when you exhale, this muscle is contracting. So with this contraction and relaxation in form of slow relaxed abdominal breathing, just go for and think about the baby. So this method, this visual imagery guided technique, will definitely going to lower your stress level, anxiety, and will make you more mentally prepared for that session which is going to be near you. That is your labor phases. Second, we talk about the basic part, like your relaxation. we all aware, as a physio, we know about how much important is the relaxation, because a third trimester woman is always worried about the, she's always worried whenever my date is going to come, what I'm going to do. Am I going to be a good mother? Am I going to be a good, am I going to protect her or him? Am I going to properly breastfeed my, feed my child? So these are the thoughts. Am I going to be back to my normal shape again, normal size again? Am I, my sexual life is going to hinder? So what is going to happen? We are worried about so much thought. And even how I'm going to join the job, so am I going to get the job as I am doing earlier? So these are the lots of tension in our mind. So these tension will create more tightness and clenching in all over body. More of cortisol will be there. So that's why she's getting less hour of sleep. She's always worried. She's because she's, every time she's using the washroom, she's using the her muscle, and she's like worried, like, if my life is going to be like this only, if I'm going to live in a bathroom only. So we have to educate her, no, this is the phase, these are the hormones. Once your placenta is going to be out of your body, all hormones is going to be at stop. So we have to just, what we have to ask the lady, either in a sideline position to the left side, or in a this relaxed position, ask the lady to just tighten her whole body muscle, like just make a fist, just close your eyes, just go for this contraction, just contract, test your whole muscle of the body, and just for 10 seconds hold it, and go for 1 2 3 4 to 10 count, and then just relax it. Do it for 2 to 3 times, and mark my word, the women, and even you are in a tension after study, just go for this method. It will work like a, like a anything. You will feel much better, relaxed, and more to your consciousness or to senses. Like, these are the hormones, these are the thoughts. Because of these negative hormones, your endorphin is down, and now because of more serotonin, more positive hormone will be there, you have less cortisol. So ask the woman to have less caffeine, because these are increasing more pressure on that area. So because of the negativity, negative thoughts, and just don't listen to everyone, because when you are pregnant, you get free advices from your colleagues, from your even एक बोलते हैं ना, राह चलता व्यक्ति भी बहुत कुछ बताता है, but you don't have to listen to them because they are not licensed for it, or even they are not a mother. Not everyone is a mother, so not every mother will remember their journey. So not every mother journey is so fruitful that is going to help you. So not so don't listen to everyone, because every woman, every story, and every motherhood is a different. So just make your own story, ask them about to their own baby, not about the everyone baby or everyone's story. So just go for visual imagery guided technique. Think about the baby, think about the good places, think about the job you want to do always. Second, go for tension relaxation for 10 seconds, not more than 10 seconds, because if she's going, sometimes the woman is holding her breath. So every time she's going for any exercise, ask her to speak with the number 1, 2, 3, so that her actual breathing is working on, her actual muscle is working on. So this is what we do as a, like as an instructor, as a physio, as an educator, as a counselor in their life. Now again, we have first is visual imagery guided technique or method. Second is your relaxation, tension relaxation. Third is come with your positioning. If you got the proper positioning during your labor, labor is not about as you saw in the movies or in any series, like the woman is lying in a lying in a couch of a obstetric doctor, and she's like pushing. No, this is only practice nowadays in India only, not other countries. They promote to be a more fruitful positioning for the, so that gravity will assist that position. Like for example, we need, due to hormone relaxin, this, there is more laxity. That means your pelvic floor muscle will have to work more tightly to hold your baby, so that your baby will not fall out. So now you can imagine, if like this muscle, this, from this muscle a baby is going to come out, and if you are going to lie like this, how you are going to create a pressure? Gravity is not going to help you, and even the pelvic outlet is going to be too close, because the, your coccyx is going to, tailbone is going to tuck, and your pelvic floor muscle, your posterior pelvic floor muscle is going to be too tight with the thinning. So means there's more chances of getting the baby's head got stuck and it is not coming out. Prolonged labor hour will be there. So that means if our woman will opt for more of positions like half squat sitting, or go for like wall resting like this, means more of position, like you can see anterior position will be there, because our uterus is anteverted. So that means we need more position which is gravity assisted, and all these positions, like or we can ask our woman to sit on a to sit on a therapeutic wall so that it is getting more space, or she can just put her head down on a lean her head down on a therapeutic wall so that she can actually create the push of her uterus, because the uterus your uterus contraction will be stimulated with a proper positioning. So she can opt for wide leg abducted sitting, she can go for forward lean bending on her either on her husband, on the doula or the nurse she got, or any one of her family member like her in-law, her mother-in-law, or her mother or sister who is inside the OT room with her. Then again, she can go for the that four position, quadruped position she can opt for, because these are the position she can actually just relax her muscle. We all know about the defecation, how we defecate our faces from this hole, the anal. You can you can imagine when we are defecating daily. So that means whenever we are defecating, whenever we are trying to contract the muscle to tightness, the faces is not going to come out. But whenever you are relaxing the muscle, the faces is going to come out. So for the second stage, this is what we have to teach our women, to educate our women. First is how to make a parallel response between the contraction and relaxation, how she has to breathe, how she has to position herself. And second, don't overexert. Whenever the phase of resting is there, just rest, because you are already overexerted. Third, just make more movement, and you have to relax this muscle, because if you're going to tight this muscle, then you can imagine how the baby is going to come out. So we have to relax, we have to teach her how to relax this muscle. But before teaching how to relax, we have to make her educate, aware. I have to isolate how to isolate this muscle from the accessory muscle, like your pelvic floor, your glutes muscle, your hamstring, your adductor muscle. Because whenever we talk about the pelvic floor muscle, the women started contracting her adductors. She's contracting her adductor. No, you have to let go everything, because you have to let go your child out of you. So same like that you are doing with the defecation process here. Just relax your muscle and push the baby out. So these are not the although the exercise you are going to get with the just go with the, if you're going for tight muscle, you have to educate our women in your OPD, in your clinic, or whether you're doing job or whether you are visiting anywhere. Just keep this thing in mind. You are not able to see her that muscle, but you can educate her while like picturing, or to snap, or to any video you got, like this is the muscle, and you have to, or either they can touch their muscle, they can touch their this part, and they can just feel with breathing pattern, like whenever they are inhaling, the muscle is expanding to ground, and whenever they are exhaling, the muscle is contracting. So through this process, in a relaxed mind, they can actually feel that contraction and relaxation means expansion and contraction. And this is what we have to educate. This is a normal process, but when it comes to actual labor, actual your birthing part, because there are three stages of birthing. In the first stage, we are talking everything about. We are talking about the first thing. In the first stage, you have to just go for normal, slow, relaxed breathing, means more rhythmic breathing. In the second part, we have to go for some kind of he blow breathing. He blow means we have to ask the lady to vocalize her breath. Means she has to shout, or she can call out with any name she think about her child, or she can just go with ooh, like these kind of things. She has to expel it out through her mouth so that she can engage her muscle, and this vocalization will help in more endorphin hormone, that is feel good hormone, and less chances of getting more pain will be there. So this is the actual birthing. We have prepared her for visual imagery guided technique. Second is your relaxation. Third is your basic positioning. Now fourth is your perineal massage. In the third is from the third trimester, from 36 weeks. We'll ask the woman to simply just have coconut oil, or just have any kind of lubricant. Just start with stimulating this muscle, this vagina from inside, and simply you don't have to use your finger inside. No, just go with the outer part only. Just go with this, slightly stretch it, then just go for simply movement. So you have to go for simple massage. Go for this, then this, and this movement. So basically, you have to just supple your muscle, because these are the skeletal muscle. So we can train them. So we are just suppling our muscle so that till our actual phase, these muscle will know how to relax. And we, at the end, we want to teach our woman to engage her breath, with coordinate with her this positioning, and just to relax this muscle and expel out the baby out of her vagina. So now again, how she has to breathe. This is the most important question. There are number of breathing we can opt for, but for the first stage, go for normal, slow abdominal relaxed breathing with a pulse slip format. Just ask her to breathe in, and her abdomen will protrude out, and her pelvic floor muscle, her vagina will go down, expand, and whenever she's exhaling, her pelvic floor muscle and her abdomen is going to be in. Her pelvic floor muscle is going to contract. Then again, when it comes to the actual contraction time, what she has to do, just ask her to go for 3 normal inhalation and exhalation with a sound, whatever sound she feel comfortable at that time. Sorry. So she has to go with this proper exhalation and inhalation, and at that time, just go with the at the time of contraction only, not about the resting phase I'm talking. Just when the nature is actually helping you, contraction is going in the uterus, the wall is just pushing the baby. At that time, just go for pushing the baby, and with the means you have to inhale and the muscle is relaxed, and you are exhaling too. Then too you have to exhale. You have to keep your muscle expanded only. So this is the, you can call it a reverse breathing too, because we are popping out the vagina with the exhalation too and with the inhalation too, so that there's more pushing. You can ask the woman to go for as much or as pushing during the contraction time, but once the contraction is over and she got the relaxation, ask her to relax. Don't clench her teeth, don't tight any cloth, don't like hold the hand of her husband or either a nurse she's having too tightly. Don't look on that mirror, on the like your that clock, so that if she's seeing the time, she will feel worried why I'm there, so much time is taking. Don't worry, just it's a natural process. Go with the flow. Think about the baby, go with the flow, go with the proper breathing, and just expel out your baby, just push out your baby. And then there comes the third and final stage. When your baby head is engaged now, ask the lady to go for more vocalized breathing and more like of he blow breathing, he blow. And now you can speak with me, he and blow. You will feel your muscle is actually going like he blow. With the blow, your muscle is actually going down. The muscle is actually expanding. And with this expansion, at that moment, when the urge to push is become irresistible, ask the woman to hold her breath for 3 to 4 or maximum 5 seconds, not more than that, to use all her strength to push out that baby, but don't tighten any of her muscle. Just push out that baby. How can, like, she will just put her the chin toward her chest and just look on her abdomen, and ask anyone who is with her to create to just relax that upper muscle of her abdomen to just downward in a relaxed manner, and she will push out for 5 seconds till her baby is out. And if the contraction is down, if she got the resting phase, then ask her to relax, because this is the pushing breathing. Means the baby is the mother is like she has lifted her head and she is like pushing for 5 seconds, not more than that, because we don't have to lessen our oxygen to our muscle, because if there's less oxygen, means more tightness will be there, and somewhere our baby head can be stuck in between. So this is the phase. You will prepare her and you will rehearse it during your session whenever she's coming to you during her second and third trimester. So now again, at the end, you will use the panting breathing. That is, go for 3 exhalation, normal exhalation, and go for pushing with it in a slow, relaxed manner and push out your baby. This is your panting breathing will be there. And somewhere in some studies, doctor suggested go for purple breathing. Your obstetrician will suggest for purple breathing. What is purple breathing? It is like the woman will hold her breath for more than 20 seconds and push the baby out. But this is totally wrong. You are going to hinder your this muscle. You are going to let oxygen supply baby there. You are going to be overexerted. Even it is harmful for your baby too. So don't go for purple pushing. Go for normal breathing, then abdominal breathing, then go for pushing phase, then go for panting breathing. The baby is going to come out in this way. Yes, there are some hand-on technique will be there, but it is not possible because we can't show it like here to our patients, because it's a OPD time only. But patients are not comfortable with this kind of session. So for more sessions like this, you can like contact me, or you can just read my book. It's all about pregnancy, in which everything about pregnancy is as a perspective of physiotherapist is inside this book. Either it's labor, it's breastfeeding, it's conceive part. Everything inside this book is there, and Just keep in mind three things. First is your posture, second is your breathing, third is your coordination. This is the actual thing you need. And third, command over the muscle, because if the woman know which muscle to relax, which muscle to contract during the actual labor session, she can master it well, and she can like she will feel less pain, she will feel she will have less number of hours of her labor, and she will have more chances of getting the normal delivery. Yes, but there are some chances if she's a high risk patient, like she's having any kind of high blood pressure, chances will be there. Your baby is in breech condition, not in this condition, it is this condition. So they are the another thing. Yet you are having the as a physio, you are having the role in that phase too. You can change, reposition the reposition the baby during the third trimester. But for this you need hand-on technique. It is not possible to tell how it is done here. So now you can go for just use the therapeutic ball and ask the woman to sit on that and just relax the muscle. Or you can just ask the woman to just sit on a towel in a wide leg abducted, in a sitting on her sits bone, like it is a towel, and ask her to relax her, let go her muscle. Because if she's let go her muscle, and don't promote kegels at that time, because kegels is an incomplete exercise, but it is it is a one exercise which is overly prescribed. But how come you can prescribe the kegels at that time when she need a relaxation? And kegels is all about the contraction. So we don't need kegels at that time. We need all about her whole muscle is going to relax with exhalation, with engagement of her mind, mental well-being and physical well-being is needed. So this is all about the session. We what we cover today is basically your three stages. Your first is effacement dilation, second delivery of baby, third delivery of placenta. In the first stage, we talk about positioning, visual imagery guided technique, relaxation. In the second stage, we talk about the contraction and relaxation phase. That means for 2 to 3 minutes when she's getting relaxed resting time, she has to relax. Whenever she's getting contraction time, she has to go for proper positioning with proper breathing activity, like rhythmic breathing, distraction breathing. Go for he breathing, he bro breathing will be there, and more of combined technique she can go for. Vocalized breathing will be there, and in the end she have to go for panting breathing. And no purple breathing should be there, means no hold breathing should be there. And when the relaxation is there, resting phase will be there. Ask the woman to rest actually, because it's a rest. You don't have to over exert yourself, because it's a natural process and the baby is will going to come out. So don't worry, you don't have to hurt yourself or your muscle or your baby, because after the delivery, either way you are going for, either you are going for vaginal delivery, you are going for your normal cesarean section, your ventouse delivery, your forceps extraction. So whatever the mode, or episiotomy, whatever the mode of delivery you're going for, don't torture your muscle. Just go with the right instinct, go with the condition of your muscle. So, and as you are going to taught her, educate her about the muscle, once she know about her muscle, she will be more commanded, more confident and less stressful. So this is all about the today's session. So now you can continue with the session. Yes, Dr. Sonam. Thank you. One more thing, just a minute. If a student here wanna reach out to more, actually it is when it is about labor and pregnancy, it is more accurate if you can saw it on an actual person. It is not possible to proceed it with ourselves, because even I'm not a mother, even I'm the one who is, even you are not a mother, even I'm not in an actual labor phase. So if you want to saw such videos, you can just move on to our YouTube channel of Hormonal Wings, that is Hormonal Wings Obstetric Dr. Deeksha Singh. You can just go and watch there. Those videos are available. And on LinkedIn, you can find I'm a writer too. I'm an author of 2 books. It's all about pregnancy. It's all about periods, and some research paper are too on this regard, because I'm a nutritionist too. So I work with this combined technique. You can just go and just read my paper on my LinkedIn. That is Dr. Deeksha Singh. You can just go, because if it is about anything about physiotherapy, we need more updation. We need more articles. We need more evidence-based practice, because it is not about I read the book, I just go and tell you. No, it is more about how much cases because in my career till now I got more than 5,000 patients, and people in India, they used to tell us ki, no woman is coming to you. because you are not approaching them. Because if the field is new to them, just go and approach them. This is not about the home visit. Don't never go for, I never promote home visit. Just go for proper training, actual ethical training, which we need in our practice. So this is it. Okay. Who told you कि obese mother can't do exercise? If she's a mother, she can do. What is the? Mhm. The question is incomplete because if you're once you are if you are obese, your obstetrician or a physiotherapist is going to ask you for losing some weight before conceiving. If you don't lose it, then don't worry. Still you can give birth. Still you have your muscle. Still you can release it. You can relax it. Now what's the worry? Yeah. Okay, post C-section, first of all, at least for 58 days, she needs some rest, some relaxation, whatever trauma and her muscle will go through it. If she has not taken any antenatal session before, just ask her, just start with the education part first. Just to show her the muscles, show her the models, show her the your prior cases or your studies. Like this is the thing, this is normal. You can go for it. Start with the scar rehab first. If the scar is too new, just don't go with the scar rehab at that time because we need some time to for healing. So before that, we can start with normal ankle pump movement. Just go for relaxation and contraction of your pelvic floor muscle because you can start with this. You can start with some kind of functional activity like you can start with breastfeeding and go for proper sitting of a posture and use her muscle with a pursely breathing because these are the exercises. You don't need a ground, you don't need a gym because you are a mother. Accept it, you are a new mother. You need some time with because nature want you to give your time to your baby. So that's why they gave you this trauma to stay home and get some time for you. Otherwise you are going to be a multitasker. You will go to your office, you will forget your baby, and you are not going to rest. So that's why you got this space. Just have it rest at all. Take your proper hydration, and once the scar is healed, just go for a scar massage. Like if this is like somewhere here, you will just two finger above, you will have your scar. Now what you have to go for, just use some kind of lubricant over there. Just imagine it's a scar. Just go for some kind of activity. You can go for push out activity with your both hand. Now go for stretching, then relaxation, stretching and relaxation because we have to release the that hematoma which is formed. We have to just start with more processes. Just go for scar rehab, which is not like as a physio tool. You should know how to go for deep tissue mobilization. Then again, accept with the change like your transverse abdominis is somewhere which is affected, so go for transverse abdominis activation along with your multifidus because if the mother is having cesarean section, that means more chances of getting in future of her back pain, her emotional trauma will be there. So just get proper history first. Yeah. Postpartum depression, just first listen to the woman whole story, like why she's feeling that low. Ask her, just go for visual imagery guided technique, like let her take some resting position and ask her to think about what she want to do, actually what she's lacking. Either it is about her figure, it's about her family, they're not giving her time, or it's about her sleep, it's about her diet, or it's about the baby, she's not feeling connected. So let the connection begin with the exercise of a mother with a baby because every time she's with the baby, she needs some time for herself too. So you can prepare her with some timetable, how she can manage her time, how she can make some time for, because she's having full of guilt at that time. Like she's not a good mother, she's not now she's not as like as she is before pre-pregnant stage. So there are number of guilts will be there, so we have to prepare her for that. So it is more about counseling than about exercise. Yeah. Actually, no one, if you are a physiotherapist, then you are aware with this truth and accept this truth. No one is going to like recommend you a patient. You are the one. If you show your patient to your neighborhood that what you can do, then definitely after a result they are going to found you by any hook or crook. They are going to come to you. It is not like I'm sitting in a home and I have my license, my degree, and I'm like thinking now I have a patient line in my house. No, this is not the way. If you want something, if you want some awareness, some changes in your region, in your zone, you just start with proper camping, proper counseling. But before counseling, you need education. It's not about you just know about the antenatal, because in the earlier time, what I saw before my practice, what I saw whenever I talk about the antenatal and post, even some of sessions, workshops are going on there, talk about that strengthening and relaxation and upper limb and lower limb. But it is not limited to this part only. As a physiotherapist, you are having an abundance role in a life of a woman more than an obstetrician, because obstetrician is already limited to her delivery part, her medical part, but you are her lifestyle. You are engaging her in her lifestyle. So it is now up to you how much important you can make yourself with your education, with your knowledge, with your papers, how much trust you can build with your patient. This is all about your IPR. Okay, all the exercise which is increasing our intra-abdominal pressure, like crunches will be there. Don't go for this activity. Don't go for forward activities which is creating more intra-abdominal pressure, because if there's more intra-abdominal pressure will be there, there's chances of in the first trimester, chances of getting due to physiological changes, chances of getting your you can have miscarriage chances will be there. Don't go for any V-shaped changes. Like क्या बोलते हैं उसको in Hindi, in yoga we call it नौका pose, in that boat pose. Don't go for that activity. Don't go for cycling in a more forward way. Don't go for gymnast activity, because you need exercise, you need strengthening, but you need it in your premises only, because with all the exercise you need to connect with your vitals too, because this is not about you only now. It is about your baby. It is about yourself, because you both are connected now. Yeah. Okay. For the electro part, we divide it into three phases again. In the first trimester, in a prenatal, then again in labor and postpartum. So in the prenatal part, just if it is possible, try to stay away from the electro part. It is if it is possible. But if it is like necessary, the woman is getting too much of pain, then you can just go for some kind of. I always suggest go for the manual part. Don't always choose electro when it comes to pregnancy. A number of hormonal changes will be there. If she lose the baby anyhow, the all burden will going to come to you only. So try to. I'm not saying they are properly contraindicated, but less number of studies are there. So you can go for tens, but don't use tens on T10. Just below 10 T10 area, don't go for tens. Just above it, you can go for muscle release. Just if you want to release the muscle now, just go for fascia release. That's great. Then electro part. If she's having pain, go for activity with the fascia release. You can use the tennis ball for that. You can use the therapeutic ball for that. But if the pain is too high, then go for tens only, because IFT researchers are there, but they are less. So I don't recommend them. And for the labor part, you can go for tens, but if it is highly recommended, otherwise go for visual imagery guided technique. That will work like a miracle. Then in the postpartum, you can go for anything. You are free now. Your baby is out. You are healthy mother. After 3 months, you can go for anything you want to use as a normal physio.